Hello, Dr. Paula Ferrada. Thanks for talking to us today. I'm going to ask you a few questions about your experience as a woman surgeon. Can you please tell us a little bit about yourself first, your training and your current position?
Well, thank you so much, Chris, for having me. I did medical school in Colombia, South America. Then I came to the United States, as many of the people that are maybe listening to this video know. Being a foreign graduate is not easy, so I spent a couple of years in Miami trying to get in a surgical residency. Then I did finished surgical residency in Boston. Then I did a fellowship in critical care and trauma in Pittsburgh, and then I did a second fellowship of acute care surgery in Maryland, and I have been for the last 4 years in Virginia.
Great, great. So, do you think you've had experiences that are specific to women in surgery that you'd like to talk about in terms of either in medical school or residency training, in terms of workplace issues?
Well, so I think the society role of the female is just different. So it's not that because I'm a female then I am handicapped, or because I'm a female then it's harder. It's just different. Being a leader and being assertive, it gets a little bit harder, and you have to be careful in how you approach that, because some males still have the preconceived concept that your role is going to be always the princess in distress and need of rescuing, which most women that are surgeons are not. So it takes a little bit of planning. It requires composure. It requires being just smart about the way that you come across and take care of those interprofessional relationships. So I would say that it doesn't prevent you from doing things, but you have to be smarter of the way that you try to achieve those things. Mm-hmm. And I think those differences probably get a little bit harder with time. I think as an intern, probably you don't feel that much of a difference, but as you grow a little bit older and try to get into leadership positions, you're going to have to find a place where you're supported and where people have a progressive point of view and understand that the fact that you're a female does not mean always that you're going to be the sole care provider for your children, that you're going to need help and support in several other roles that you're trying to achieve excellence on.
Yeah. So that's an interesting observation to me. So the further along you get, in other words, perhaps when you need to be more assertive and you're showing more leadership roles, and that's when it becomes harder.
Yeah, absolutely. It gets trickier, and it gets trickier. And I'm not sure that this is just in surgery.
Sure.
I would believe that in any position of leadership in the corporate world, or even in nursing, when nurses have to deal with nurses and they go up in administrative positions, is probably the same kind of struggles that they have in proving themselves and. When you try to achieve something, you have to always be careful in the way that you come across. And I think that is more a concern and a worry when you're a woman than when you're a male. Sure. But that is just my perception.
Sure. And you did medical school in Colombia.
Yes.
At that level, you aren't leading much. I mean, whether you're in Colombia or whether you're in the United States, when you're a medical student, you're mostly following and learning and observing. Did you find the same sorts of women-specific issues in Colombia as in the United States?
So I think in Colombia it's probably a little bit more. So I was leading a little bit in Colombia because I was the president of the Medical Student Association. Oh. So, but I think as medical students, you have it's a wonderful opportunity because everything is exciting, everything is new, and when you have that passion for something and for changing something, I think that's when true leadership begins. I mean, it's not leadership in terms of title, but leadership in terms of doing something meaningful that is going to help patients and help us all grow. I think in Colombia, there's in many places in Latin America, they are like 50 years behind in terms of supporting women.
Oh, is that right?
I think they need to support them into helping them getting into medical school. There's not an equal number of medical students that are females or males, or at least it wasn't when I trained in medical school. And to help them stay in the field and not work part-time or not work at all after you sacrifice that precious amount of time studying and becoming a physician. So I think there's a whole room for support in Latin American countries, and in some places they're still in diapers compared to the amount of support that you can find in the United States.
Mm-hmm. And how about your experience now? You are a practicing trauma surgeon and ICU doctor. In terms of family planning and perhaps a glass ceiling, how do you think your experience is compared to your male counterparts?
I think I am lucky that I'm in an institution that supports me and supports what I do. But I think when you're trying to, in general, when you're trying to decide where should you go for a job, I will pay attention in the places where they have enough female role models, enough females in leadership positions. So that kind of tells you, do they support that kind of leadership in women? Of course, roles are different. When you have a child, the child is going to want mommy better than daddy. I'm sorry, but so you kind of have to, again, be smart in the way that you plan and have a supportive family that will help you. I think a huge void of institutions in the United States is to be able to provide for daycare for all, not only for physicians for me that now I have some control of my time, but when you're in residency, there's no control of your time. It's extremely difficult to be a parent. And we keep wondering why women don't stay in the workforce in medicine. I think that's a huge part of it. If you don't give those women the support that they need to be able to feel good about being a good mom, being a good wife, being a good sister, being a good partner, and being a good surgeon or any other specialty, pediatrician, internal medicine, if you don't provide for that support, then you cannot be afterwards as an afterthought scratching your head and saying, oh, we're giving all these opportunities to women that are quitting. There's a reason why they're quitting. And one of those reasons is being able of feeling, under supported. And part of it is the people that and then I'm not sure that you can see is more obvious in women. But when you're a parent, even if you're a female or male, whatever gender you are. How about single parents that are male genders with absolutely no support of childcare? Yeah. But you're expected to be in the hospital for, at 5 a.m. in the morning and work 80 hours a week. Who's going to take care of the child? Yeah. So I think we all, as an institution, need to do a better job in understanding that as physicians, we're also human beings, and we want to be the best that we can in every role that we need to fulfill. With this parenthood, which is friendship, whether there's a partnership or, a physician or a surgeon.
Mm-hmm. Well, how about interpersonal or professional interactions in a hospital? How do you think your experience is different there? Do you think being a female surgeon has a different dynamic in the operating room than a male surgeon? Or do you think when you're working with nursing or ancillary staff that you have a different experience than men?
At the beginning, I felt that there was definitely a difference. I feel sometimes, but that difference it just takes time and perseverance. I feel that in general, nurses might be in some cases more respectful to males, and it takes a little bit harder for them to. But again, it's the way that you have to be smarter than that. That's my point. You cannot sit and think and say, oh, because I'm a girl, they don't like me. the way of approaching that issue is not making it an excuse for not being successful. I think the way to approach that issue is being smarter, think ahead, I don't know, be nicer, be able to understand that every single interaction that you have with people adds some to the perception that they have of you. And I think if you culture that appropriately, having a friendly relationship with people that you work with goes a long way.
Yeah.
People will want to see you succeed rather than being upset all the time. And then I wouldn't want to see succeed somebody that yells at me all the time. So I think regardless of women or male, I think we all have to be smarter in the way that we approach interpersonal relationships at work.
Oh yeah, that's great advice for both genders, indeed. Well, is there anything you'd like to say? A bit of advice for anything else you'd like to say to advise young girls or young women considering a career in surgery?
Well, I would hope that young medical students or even high school students are considered to be physicians or medical students are considered to be surgeons do not get discouraged by just don't get discouraged, period. When you really love what you do, I absolutely love my job. I love what I do. There's nothing I'm a trauma surgeon. There's nothing for me that will replace ever to be able to save someone's life, even if nobody pats me in the back, even if the patient is not grateful, and it is regardless of anything else that I do. No presentation, nothing else replace what the satisfaction that I have when I do that. And if you really are that passionate for what you do, don't let yourself be discouraged. I think it's important to have a plan and just, sit down and think about, make a plan of what you want to do. But I think us women, for some reason, I had a friend that said that she didn't want to be a surgeon because she wanted to have a family. I don't understand how those things are mutually exclusive, but she's still single. So you prevent yourself from doing something for an hypothetical husband that doesn't exist and children that doesn't exist and a boyfriend that doesn't exist. I think planning for the things that you want and actually not making apologies for the things that you want, goes a long way. Planning, redefining your plan, and just do the best that you can every time.
Great.
I think I told you this before. One of my mentors told me once, be excellent. And I think that means be excellent in everything. Be excellent. Be the best that you can at all times. And that definition of being excellent is different for each one of us. And it doesn't have to be an excellent surgeon. Some people don't want to be a surgeon. But I think if you apply that every day, it just makes you, at the end result, it just makes you happier.
Indeed. Good advice. Well, thanks. Thanks for talking to us today. I hope we can talk again soon on some other topics.
Thank you. Thank you so much, Chris.
Thanks, Dr. Ferrada. Bye-bye.
All right, bye.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.